Who's Faddle? Sharit. Hi, this is Dan from Dear Human Mechanics. So we're going to run a short series that will enable you to answer a lot of questions that you have been asking me anyway. And it'll dictate your next few thoughts. So, the age-old question, can I pick my nose and eat it during COVID-19? Is that safe? Or, should I stretch or should I strengthen? Lots of people stretch because it's easy, because we get this short-term feedback of relief. But actually, there's very minimal long-term benefits to it at all. And for those who do receive it, they are stretching a lot, every day, consistently for a long period of time. But actually, does that help functionality? Big question mark over that. And my perception of it is, not really. Most that I see, are flexible enough for what they want. But it doesn't take away the fact that they feel stiff, or their hamstrings feel tight, or their calves feel tight. But the feeling of stiffness doesn't necessarily suggest that it has any impact on movement. But this is where you lot come in, okay? So, the next few series is, should I stretch or should I strengthen? Okay, I'm going to start with the lower limb. Nice and easy. Okay, I'm going to start at the bottom and work up. Piece of piss. Okay, do you feel tension in your calves? Do they feel tight whilst running, during running, after running, especially after running? If so, this is a test for you. See whether you need to stretch or strengthen. Okay, no equipment really necessary. You just need something that doesn't move that you can use as a guide, okay? So, you're going to start with your toes against the wall, against the chair, against whatever, okay? Your heel stays flat on the floor. Can your knee touch the wall, or whatever this may be, without your heel lifting? If so, move back. Again. Move back. Again, up until the point where your heel has to lift for you to be able to manage that. Then you're going to measure the distance between your toes and the wall, the chair, the table, whatever it might be. Okay, question number 1. Was your left leg the same as your right leg? If there was a discrepancy, then improve the one that wasn't as good. Nice and simple. Okay? If they were fairly symmetrical, but you weren't sure, or you're not sure what's a good score and what a bad score is, I would suggest somewhere between 3 and 4 centimetres between the wall, or whatever it might be, and your toes is reasonably good. If you could not do it, even with your toes against the wall, where your knee couldn't touch the wall, or whatever it might have been, without your heel raising, you need to stretch, okay? Stretch your calf complex, and we'll go through different types of stretching after this, but again, bear that in mind, write it down that that's an area that you need to mobilise or stretch, and we'll come back to it, okay? Okay, test number 2. But my hamstrings feel tight. So, we'll soon see whether your hamstrings are tight short, where they require stretching or not, or whether they're just tired and fatigued, or don't tolerate the loads that you're putting through it. Okay, so nice and simple test, no equipment required, find a bit of space on the floor. Okay, lie flat on the floor. One leg straight, other leg straight. Lift up as far as you feel like you can. Do you feel tension in the back of your hamstring that prevents your leg from moving up further? And get a guide, take a picture if you need to, of how far this leg goes up in comparison to this leg. Again, what's important to know is it will always feel tight at the end of that range. But the end of that range is individual to you, okay? To determine whether they are tight and need stretched or not, and what you need them to do, okay? If you are a runner, and a long distance runner, and you average 7-minute miles, I suggest the amount of movement you require in your hamstring is this. Okay? I would suggest somewhere 70, very good, to be 80 degrees. I notoriously have quite tight hamstrings, but I get to 80 degrees hip flexion, this movement, and that's fine for me, that's all I need. Okay, so put it into context. Do you have enough to allow you to do what you need to do. If you do, and you don't run like this, then I suggest that you don't need to stretch. Okay, you make that decision. Okay, let's move around. Hip flexors, really important, often overlooked area. That certainly influences your biomechanics of running and your efficiency through movement. And we're going to decide whether you are tight and require stretching or you're weak. Okay, so find a table or something that's not going to break. Your bum hangs off the edge. Lower yourself down, grab a knee and relax this leg. Let it do whatever it wants to do. And you're going to look at the relationship between your hip and your knee and your heel. So as you can see on mine, my knee is suspended in the air and my heel is miles away from my knee, which suggests there is levels of tightness within my hip. Okay, so again, your job, same as all the other tests, compare left to right. Is there some sort of asymmetry? If there is, then you may need to work on your most affected side more. If not, then you decide whether it looks like it should or whether it restricts movement, therefore needs some sort of mobility work on. Okay? Have a go, see what you think. If you're unsure, then get in touch, of course. Ta-ta. Okay, so really important note and a caveat to all them tests are, if you are tight, if you show restrictions in range of movement, the question is, why? Why is that? Do you have stiff soft tissue that if you were to stretch it, it gives you long-term benefits? The answer being, probably not. What's really important to know is, if you're going to stretch, foam roll, trigger point, all of the above, it will allow you short-term benefits. It will allow you to improve ranges, potentially, for that moment in time. However, if you don't use that improved range of movement to improve strength, all the benefits are lost. Okay? So caveat to all this is, yes, if your range of movement is lost, you probably should stretch, mobilize to some degree. Okay? That will give you short-term benefits. But ask yourself the question, why do I keep becoming stiff tight? Okay? The answer is, your central nervous system, your brain is trying to protect you. So it steals movement off you. It reduces the ranges that it wants you to have. So if you just keep stretching it, and that's all you do, you aren't listening. You aren't listening to your body. Okay? So the be-all and end-all is always find a good way to improve some sort of load tolerance. We always use the word strength, even myself, and I don't really mean strength. Well, I'll do a video on this later as well. It isn't necessarily strength training that you're doing. Lots of personal trainers, lots of coaches, lots of strength and conditioning people might use them terms, strength and conditioning. It's not. It's often not. What we're really aiming for is a load tolerance, for you to be able to tolerate more load. That doesn't necessarily mean you're getting stronger. Okay, have a go. See what you think.